The intrauterine device, the IUD, is one of the most effective methods of contraception we have. It lasts 5 to 10 years and it's the size of a 50p piece. So if you make a fist, that's how big your womb is, and you can see that it easily fits inside. The copper on it stops the sperm and the egg meeting, and therefore you don't fall pregnant, and as soon as you take it out you can fall pregnant in the future if you wish. There is another intrauterine system, which is the IUS, and that's a hormone releasing coil, again the same size, and again it fits in the womb and releases the hormone slowly over time, and that changes the lining of the womb, and therefore the periods can get lighter and in some cases stop completely, and as soon as that's removed the woman can fall pregnant straight away. Both methods are very effective, very simple to insert, and very easy to reverse. The IUD and the IUS can be inserted usually when you first come to the clinic. You'll go to reception and you'll let them know what you've come to the clinic for. You'll fill out some paperwork, and then once you call from the waiting room you'll see the nurse or the doctor who will be doing the procedure, and there'll be about 10 minutes of taking a history and making sure that the method that we're going to give you is effective and appropriate. We'll do pregnancy tests. We'll also offer you a test for sexually transmitted infections, because STIs are common in young people, and we can do that at the same time. And then we'll move you into the clinical room. It's pretty straightforward. We'll ask you to undress and remove the lower garments in private and cover yourself with a paper towel, and then when you're ready we'll come in. And this is done with the chaperone, who will be there to support you but also to help the clinician doing the fitting. First of all, we need to know how big the womb is. That's a bimanual exam where the clinician will need to insert 2 fingers inside the vagina and feel on the abdomen so they can see how big the womb is and where it's positioned inside the pelvis. Then we'll put in a speculum, which is a small plastic device with a lubricant, so that we can put that in the vagina and open it up and see the neck of the womb. And that's when we'll put the local anaesthetic there, which is a local anaesthetic gel or a spray. And we'll then take the speculum out and give that time to work whilst we show you the device that you've chosen and you want to have fitted. We'll then go ahead and fit it, which just takes around 3 minutes, and we'll put the speculum inside the vagina again. We'll hold on to the cervix so it doesn't move, and that feels like a pinch. We'll then measure how big the womb is using a sterile device, and that will touch the top of the womb and cause a period-like cramp, but that's again only short-lived sensation. And once the device is put inside the womb, you may contract around it and feel a little bit of a period-like cramp sensation, but that will wear off pretty quickly. We'll cut the threads that are attached to the IUD and the IUS. We'll then show you the threads that you can actually feel if you touch the neck of the womb afterwards, and we'll give you, we'll teach you how to do that before you get dressed and come back into the clinical room for your paperwork and to discuss any other things that we may have to finish off. If you would like someone to join you, you're welcome to bring them during the procedure. But as I said, there will be a chaperone as well as the clinician doing the fitting. But whatever makes you comfortable, we'd like to accommodate that. After the IUD and IUS has been fitted, most women will feel some cramps, period-like cramps, and they can last up to 48 hours. If you take pain relief for period cramps, then obviously you can do so after this device has been fitted, and that will help with the symptoms. We do need to make you aware that at the time of your period your body can push out the device. With the intrauterine system, because the periods usually get lighter over time, that risk goes down over time, but with the IUD you'll have a period every month. So we teach you how to feel the threads so you can check after your period that your body hasn't pushed it out. Some women, after having an IUD and IUS fitted, will feel a little bit faint, and this happens in about 1 in 40 women, and they will need a little bit more time to recover, maybe a sweet drink or a cup of tea to feel right again. There is a rarer complication called a perforation, and that's when the uterus contracts around the device and it goes through the wall. That can cause pain, and of course if that happens and that pain continues, then we ask women to come back and see us and we can assess if that's the case. It's a rare complication, less than 2 in 1,000, which slightly increases when a woman is breastfeeding. But if that does occur, then we can remove the device and it all heals and there aren't any long-term complications. That's just something to look out for. Most women that have had the IUD and IUS fitted don't need to come back to the service. We teach you to feel the thread so that you can be reassured after your period that it's still there and it's still in place. The devices themselves last 5 years mostly. Some of them are slightly shorter, some of the hormone intrauterine systems last 3 years, and some of the IUDs last 10 years. If you want to come back and see us because you want to change the method or fall pregnant, then come back at any time. But the beauty of these methods are that you are in control, you don't have to keep on coming back to services, and your fertility will immediately return back to normal as soon as you decide to stop the device.